scans lit up. He was having headaches. He had a big mass, almost the size of a half of a fist. He came to us for treatment. We treated that, and the pain went away. He had 2 other spots. We treated those, and they went away. He just came on Friday now, 6 months later, for restaging, and all these areas have been successfully controlled. His pain is gone, his cancer's in remission, his PSA is low, and he's doing great. So it's a good news department. And also on Friday, we had an interesting woman who came with an acoustic neuroma. An acoustic neuroma is a benign tumor of the 8th cranial nerve. It's called a brain tumor, but it's really a tumor of the nerve going from the brain to the ear for hearing and balance. The 8th nerve is responsible for both hearing and balance. And actually, I met her several years ago and talked about treatment options. And at that time, she decided she wanted to wait. And she waited. She started dating a man. And as she was dating the man, the tumor was growing and her face was twisting. And her hearing was getting worse. And there was buzzing in her ears. So she just wasn't tolerating the tumor, and now all of a sudden she had a love in her life, and she wanted to get this tumor taken care of, where a couple of years ago she didn't seem to care. So we actually have the world's largest experience treating acoustic neuromas with fractionated brain radiosurgery, which in our hands is a non-invasive technique, and we treat a lot of benign brain tumors like acoustic neuromas, meningiomas, pituitary tumors. We also treat a lot of cancerous tumors like metastasis and gliomas and glioblastomas. But we treated her about now 8 months ago, and incredible, her face returned to normal. Her hearing improved. She's had no adverse effects. She's doing so well. She's in a meaningful relationship. The tumor symptoms have gone away. She's had no adverse effects. And this is pretty typical of patients that come to us with acoustic neuroma treatment. I got an email this week from a patient, actually from the wife of a patient. The patient had surgery and was left deformed from the surgery. And then within a short period of time, the tumor started growing back. And that's fairly common after surgery because the surgeon often can't get all the tumor. And then they had a different style of radiosurgery, and there are different styles of radiosurgery, which we'll explain when we meet you. But in general, you can have non-invasive treatment where we make a few divisions of the radiosurgery, or some people use an old style, which we abandoned. To tell you how old it is, we abandoned the old style in 1993 because it was painful. It involved screws in the head, and most patients just can't take the pain and discomfort. So we've gone to a new technique that takes advantage of fractionation, which is safer, more comfortable, better tolerated for the healthy tissues, and we've seen a dramatic improvement in results and in comfort. So yes, what kind of radiosurgery you have matters. This woman had an acoustic neuroma, treated last year. She's a 60-year-old woman, doing well, happy, healthy, and new scans prove that she's in remission. And that's what it's all about here. And another woman, so we have a lot of interesting, unusual cases tonight. Another woman came. Her son, who's a pharmacist, contacted me about 10 days ago, explained that his mother, 65 years old, had metastatic cancer from the lining of the uterus, metastatic to liver. So she came in, and I met with her and spoke with her, and she told me, what's really bothering me now are 2 things. One is my face is numb, and 2, she has so much pain from the cancer in the liver. Now, this family was going to one of the biggest hospitals in New York, one of those that have all the full pages in the New York Times all the time, saying how great they are, and yet her doctors knew about the numbness of the face, did nothing, knew about the pain, and it was just trying to push more and more chemo that never worked at all. She was diagnosed 2 years ago. She started chemo then. She had a short remission. Last year, the cancer came rip-roaring back in the liver. She started on chemo. She's been on it for 9 months. It hasn't worked. The cancer spread. She came to me. I said, I suspect there's cancer pinching the nerve going to your face. She said she couldn't believe it. She saw all these other doctors. No one even mentioned it. They didn't even ask her about it. So we got 2 tests that same day. That's the beauty of the people we work with. We can get tests done quickly. We got approvals from her insurance companies. We fought that day to get them, got the test that day, and she had the answer that day. And the answer is that we found a piece of cancer pushing exactly on the nerve, causing numbness of her face. Now, it wasn't so easy. I make it sound a little bit easier, but we had to fight for the scan. Then the first radiologist said the brain was pristine. It was perfect. And I said, it can't be. I don't believe it. I believe this patient. I believe the patient more than I believe you. I told the radiologist, and I've known this radiologist for years. And he said, okay, I'll get another radiologist. They got another radiologist. He said, this is pristine. I said, I don't believe you either. I want another radiologist to look at it. She's got numbness of the right face. I believe that the branch of the trigeminal nerve, which is the 5th nerve off the brain, is being pinched. And the third doctor looked at it and said, Dr. Lederman, you are right. We're all taking off our hats to you. And that's what we do, fight for the patient. You have to believe in the patient. She was telling you the face was numb on one side. I don't believe she made that up. I believe the patient. And I pushed the doctors to find the cancer. We found the cancer, and we actually already started treatment to hit the cancer. She came in just on Wednesday last week, and she's already had the scans, the planning, and the treatment to stop the cancer that's pinching that nerve that's causing numbness of the face. And about the pain in her belly, that is from the cancer in the liver, which her other doctors were ignoring. They were giving narcotics, which caused her to go to the bathroom only once every 4 days. She lost 20 pounds in 3 months. Even on the pain medicines, we're going to attack the cancer in the liver with radiosurgery and the cancer in the brain. And then the family came to me and said, wow, out of the clear blue, well, what about topotecan? We're supposed to start topotecan chemotherapy tomorrow. What should we do? I said, look, you've had chemotherapy for 2 years. It hasn't worked. You can do what you want. But if something doesn't work for 2 years, what's the likelihood of it working today? And the answer is very, very little chance. So she suffered from the side effects of chemo. Of course, the hospital wins by giving chemo, and we know that a lot of drug companies are paying hospitals to give chemo. But what does she win? So she's decided to have the radiosurgery for this nodule in the brain, small, but at a critical location, and radiosurgery to treat the liver to try to get the pain and suffering to stop. So it's an interesting woman, interesting medical condition, and we hope that she recovers. We have good chance that she will indeed recover. There's an article that was also in the New York Times this week, written by Michelle Holmes and Wendy Chang. These are 2 doctors from Harvard Medical School, and they're talking about an interesting proposition. In 2010, and I'm reading from what they wrote in the New York Times, we published a study in the Journal of Clinical Oncology showing that women with breast cancer who took aspirin at least once a week for any reason were 50% less likely to die of breast cancer. Wow, can you imagine that? You take aspirin once a week and you reduce your mortality by 50% of breast cancer. And then in 2012, British researchers combined other trials that looked at aspirin to reduce heart risk and other things, and also found that aspirin was associated with a lower risk of breast cancer death. And they're saying, but there's no randomized studies. What's a randomized study? Half the people get it, half the people don't get it, and then follow. So what these 2 women are proposing is a randomized study, and they say it's hard to get this study. Why? Because you can go to Costco and buy 1,000 aspirin for $2, so no one's going to make their billions of dollars by selling aspirin. So finally, there's a randomized study in Great Britain being funded by a non-profit group called Cancer Research UK. It's looking at 4 cancers, but it won't be done until 2025. These two women are asking for a study in America. They say it will cost about $10 million. And they describe aspirin. It was originally derived from the willow bark. It's been used as a painkiller since the time of Hippocrates. No one knows why it seems to work in fighting cancer. Aspirin reduces inflammation. Maybe it inhibits the growth of tumors. Maybe it inhibits blood vessels that take blood cells to nourish them. It's not really known other than it's an observation. So will we know the real answer about aspirin decreasing breast cancer deaths? Yes. And hopefully we'll know about it in this country. We'll know about it from the study in Great Britain. It's an interesting proposition, a little medicine that costs almost nothing that can reduce possibly thousands of deaths each year from breast cancer. We are now going to hear from some voices talking about radiosurgery. These are our friends. And then we'll be back. Again, we're live at the WOR studios at 1-800-321-0710. 1-800-321-0710. Here we go.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back and taking your calls. I want to talk about a gentleman very interesting. He's 87 years old. He came to me this week. I treated him for prostate cancer 15 years ago. He was a high-risk patient. He had a PSA of 14, treated in the stereotactic frame with brachytherapy. Now, you think he's probably back for prostate cancer. The answer is no. His prostate cancer is in remission 15 years later. Yes, there are cancers we cure, and prostate cancer, vast majority, we cure. You should look at the data. That's not why he came in. He came in because he's an Irish heritage. He has a huge skin cancer over the left temple, forehead, down to the ear. He was going to see surgeons at one of the big hospitals in Manhattan. He saw them. They scheduled the surgery. They were going to cut off half his face and his ear and do reconstruction and flaps and grafts and blah, blah, blah. And he came to the hospital for the surgery, and thank God, someone in the hospital said, "You can't have this surgery. We won't allow you to do this surgery." Thank God. And